The vector of African trypanosoma is a fly, Glucina fly. Other name of Glucina fly is tese fly. Tese fly is principal or main vectors of African trypanosoma, Gambians and Rhodesians. Male and female of tese fly can remove the trypomastigote from peripheral blood of infected human and animal reservoir hosts during blood sucking. And trypomastigote in midgut and in stomach of tese fly change to epimastigote. Epimastigote form and move and reach to the probis of tese fly and change to metacyclic form. Metacyclic trypomastigote. Metacyclic is infective and penetrate by saliva of tese fly and reach to the body of human and animal reservoir hosts. So, in life cycle of African trypanosoma, we have both morphological shape, trypomastigote and epimastigote. Epimastigote in vector, tese vectors, trypomastigote in peripheral blood of human and animal reservoir hosts. This is the life cycle of African trypanosoma. In clinical, African trypanosomiasis has 3 stages of clinical manifestations. The first stage is cutaneous. The first stage is cutaneous form. In the place of biting of tese fly, produce a lesion, a small lesion. The name is trypanosomal shank. Trypanosomal shank. Trypanosomal shank, a small lesion produced after biting of tese fly and disappeared after 1 or 2 weeks. Disappeared. And the second stage of the disease appeared. The second stage is hemolymphatic stage. The trypomastigote disseminated in the internal organs, such as liver, spleen, and lymph nodes. The pathognomonic sign of the African trypanosomiasis is enlargement of lymph node, especially the lymph node around the neck. Lymphadenopathy by trypanosoma is pathognomonic name, and the name is Winterbottom sign. Winterbottom sign. Winterbottom sign is a pathognomonic clinical sign of African trypanosomiasis, enlargement of lymph node around the neck, behind the neck. Winterbottom. Winterbottom is an English physician, lives in endemic area of African trypanosomiasis and registered the lymphadenopathy to Winterbottom sign. Winterbottom sign, enlargement of lymph node around the neck. As this slide shows Winterbottom sign, enlargement of lymph node appear in African trypanosoma, especially in Trypanosoma gambiensis. This pathognomonic sign. And the same stage is cerebrospinal. This is very dangerous sign of the disease. And the trypomas reach to CNS, central nervous system, and produce dangerous clinical signs such as severe headache, nausea, and the end of the disease, very sleepy, and the name of the disease is sleepy sickness with high mortality rate. And this is said for all African trypanosomiasis. As you see in this slide, different clinical form, and this is a test or glucinafly. Glucinafly is a main vector of Trypanosoma gambiensis and Trypanosoma rhodesiensis, distributed only in African region. And epimastigote developed in test, and this slide epimastigote form, and produced this epimastigote form and produced a first stage. First stage then is trypanosomal shunt. And second stage is Winterbottom sign. And third stage is cerebrospinal sign. For the diagnosis of the disease, we can use from parasitological methods, such as microscopy, culture, and animal inoculation, such as leishmania. But in leishmania, in culture, we can see promastigote form. In African trypanosoma, in culture, we can see epimastigote form, not promastigote form. And serological test. The specific serological test is card agglutination test. It's a simple test with high sensitivity rate and used from in the field outside the hospital, and we can use this test, card agglutination test. And other test is molecular methods such as PCR, and we can use this PCR for differentiation between Trypanosoma gambiensis and Trypanosoma rhodesiensis. And for the treatment, we can use different drugs for first stage and second stage. The drug of choice is suramine and pentamidine. is drug of choice, but when the treponema reach to CNS, we can use from arsenic compound. Arsenic compound is very high toxicity drug. Name is melarsoprol. Because the mortality rate of sleeping sickness or cerebral spinal infection is very high. We can use from arsenic compound for the treatment of say stage of African trypanosomes. But in one stage and two stage, we use from eflornithine, pentamidine, suramine with a low toxicity rate. And we can use from different methods for the control of the disease, for example, from insecticide for prevention of vector and vector control, reservoir destruction, very difficult, and public health education. It's very different methods for the control of African trypanosome. And in American trypanosomiasis, in American trypanosome produced by two trypanosomal species. The first is Trypanosoma cruzi, and the second is Trypanosoma rangeri. Trypanosoma cruzi is pathogen, but Trypanosoma rangeri is non-pathogenic, but similar together under microscope. Trypanosoma cruzi produced Chagas disease. Chagas is a medical student in Brazil. Discovered the disease caused by Trypanosoma cruzi in 1914, about 1 century ago. And Chagas disease produced by Trypanosoma cruzi. Trypanosoma cruzi is a zoonotic disease. More than 100 animals are reservoir host of the Trypanosoma cruzi. So this form is zoonotic. And the vector of Trypanosoma cruzi and Trypanosoma rangeri is a bug. The genus and species is Triatoma infestans. Triatoma infestans is principal and main vector of Trypanosoma rhodesians and Trypanosoma rangeri in American region. Triatoma infestans during blood sucking remove of trypomastigote and emastigate form of the parasite during blood sucking. Triatoma infestans, but and this form change to epimastigote and promastigate. In the midgut of Triatoma infestans and transmitted to healthy human, but feces of the body. So, African trypanosoma transmitted was salivary of vector. Name is salivarian trypanosoma. Salivarian trypanosoma is included trypanosoma gambiense and trypanosoma rhodesiense because this trypanosoma transmitted by saliva of vectors. But trypanosoma cruzi transmitted by the feces of vector, not saliva. This name is estercorarian trypanosoma. Estercorarian trypanosoma. So we have two forms of transmission of trypanosoma: salivarian trypanosoma and estercorarian trypanosoma. Salivarian trypanosoma included trypanosoma gambiense, trypanosoma rhodesiense, and trypanosoma rangeli, but the only estercorarian trypanosoma is trypanosoma cruzi, produce Chagas disease. As you see in life cycle of trypanosoma cruzi, we have 4 morphological shapes, not 2 morphological. In human and in animals, we have trypomastigon and emastigon. In vector, we have poromastigon and epimastigon. 4 morphological shapes can see in life cycle of trypanosoma cruzi. The disease produced name is Chagas disease. Chagas disease, a parasitic disease produced by trypanosoma cruzi. We have 2 forms of Chagas disease: acute form of Chagas disease and chronic form of Chagas disease. Acute form usually appear in children with fever, with chills, with sweating, similar to malaria manifestations. But chronic form of Chagas disease is very, very dangerous because emastigon form of trypanosoma cruzi located in myocard and in muscle of digestive system and produce chronic form of the disease. This is a vector of trypanosoma cruzi. The name of this vector is Triatoma infestans. This bug is blood sucking and distributed in 17 countries in American region. And this is trypanosoma cruzi in peripheral blood of human, infected human. As you see, this is trypomastigon form, C-shaped form, and a posterior kinetoplast, 3 flagellum, and a nucleus. And Chagas disease. In acute Chagas, we have a pathognomonic sign. Name is Roma sign. Romano sign. Romano sign is inflammation of the face. Inflammation of the face is Romano sign, and then with fever, chills, sweating, this is acute form of Chagas disease. And chronic form of Chagas disease, emastigon form, multiplication in myocard and produce myocarditis. And in digestive system, esophagus and colon are infected to Emastigode form of Trypanosoma cruzi and produce megacolon with abdominal pain, vomiting, and other clinical forms, and emastigode form in myocard. These are emastigode form. This is chronic form of Chagas disease. And for the diagnosis of Chagas, we can use from parasitological methods such as microscopy, culture. We can use from Trian, similar to Leishmania, and we can use from animal inoculation, and we can use from serological methods such as DAT, ELISA, IFR for Chagas disease, especially in acute Chagas disease. And we can use from molecular methods such as PCR for differentiation between Trypanosoma cruzi with Trypanosoma rangeli. As I mentioned before, Trypanosoma rangeli is non-pathogenic and does not need any treatment. But Trypanosoma cruzi needs immediately treatment and appropriate treatment for prevention of chronic form of Chagas. We have a specific diagnostic method for the diagnosis of chronic form of Chagas disease. Name is Gezeno diagnosis. This is a specific laboratory technique for the diagnosis of chronic form of Chagas disease. In this procedure, we can use from Triatoma infestans, we can use from bugs, but uninfected bugs, breed in laboratory and put on the body of suspected patient. After blood sucking, isolate the bugs and transport to laboratory. After 20 days, dissected the bugs and under microscope. If we see the promastigode or epimastigode for a flagellated protozoa, the patient is positive. After 20 days, this is Gezeno diagnosis, a specific procedure for the diagnosis of chronic form of Chagas. A specific. And for the treatment of Chagas disease, we can use from effective drugs in acute form of Chagas, such as nifortimox, benzimidazole is effective drug and FDA approved drug for the treatment of acute form of Chagas. But in chronic form of Chagas, no chemotherapy effective, and we can use from surgery in the first stage of the disease. And control of the disease is very, very difficult because Trypanosoma cruzi has more than 100 animals for the reservoir host of the disease, and control is very difficult. For the control, we can vector control, we can use from vector control. Reservoir destruction is very, very difficult, and public health education and environmental sanitation help to decrease the incidence rate of the disease, especially in countries endemic for Chagas disease. The most important country is endemic for Chagas is Brazil. Thank you very much.
Thank you so much.
Practical class, practical class in